Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Nashley Steele, who is an emergency room doctor with Baptist Health. Welcome.
Thank you, Dr. Fox.
Now, emergency room does, you see anything. I mean, you don't turn away anything. But, you know, a runny nose, a cough, a sore muscle may not be an emergency, may not. So give us an idea, when should people access the emergency room and what are true emergencies?
You're exactly right. I mean, may not is the optimal word there. Honestly, we're willing to take care of anything that comes through the door. But an example of something that might be appropriate to come to the ER would be chest pain. Chest pain is something that we take care of on a pretty regular basis and are pretty comfortable taking care of, and we have all the resources to work it up and take care of it appropriately. Okay.
You mentioned chest pain, but what about things like abdominal pain, headaches? Is there any parameters that would say, okay, this is something I need to see, or do you need to call your doctor to see if you need to go to the emergency room?
Well, when you present to the emergency department, the triage nurse is going to evaluate you, and based off your complaint, they assign an acuity. And based off that acuity, we'll often determine how quickly we will get to your given presentation. Of course, if there's nobody else in the ER, we get to you as quickly as we can. But certain things will have higher acuity, so a very concerning chest pain would lead to us evaluating you very quickly and getting the workup initiated very quickly. One of the things we pride ourselves on is getting an EKG done in less than 5 minutes and having a physician evaluate that EKG in less than 10 minutes. So certain presentations do lead to us acting quicker because a couple of them are chest pain and then stroke-related complaints. As they say, time is heart and time is brain.
Okay. Now, you mentioned certain things. So what are some red flags with chest pain? Say, hey, okay, this is important. I got to take care of it.
Obviously, risk factors make a difference, but as far as history and presentation, if somebody presents with a complaint of crushing chest pain, with it radiating into their neck or into their jaw, if they're diaphoretic, which is just a fancy way of saying sweating excessively, if they're feeling nauseated, all those things would lead to us having a high level of concern. And of course, vital signs, they're called vital for a reason. If those are abnormal, that's going to further increase the concern and lead to us acting very quickly.
Okay, now you mentioned the EKG a few minutes ago. What's some other things people can expect when they get to the emergency room with chest pain that you might do to say, okay, is this or is this not a heart attack?
Yeah, we start with the EKG because if somebody has what's called a ST elevation myocardial infarction, that will lead to us contacting the cardiologist immediately and an air facility at least activating the cath lab to try to expedite their care. Once we verify that it's not a STEMI, but yet still could be a very concerning presentation, we initiate lab evaluation, imaging evaluation, and then that's when we rely on the team that is the emergency department and the ancillary services, including their respiratory therapists, their X-ray and CT technicians, and then of course their excellent nursing staff.
Now you mentioned labs and imaging. What are you looking for there?
Well, when it comes to chest pain, if you do a basic chest X-ray, you're going to be looking at the lung. You want to make sure that you have well expanded lungs, that you do not have a collapsed lung, something called a pneumothorax. You're going to be looking for infiltrate or infection in the lungs. In regards to the heart itself, you're really looking at what's called the mediastinum to make sure that it doesn't seem widened if somebody has potentially a dissection or a very large aneurysm. That might be something that gives you an indication based off both the combination of the history and the presentation of the patient and that chest X-ray to pursue more advanced imaging studies, such as perhaps a CT scan.
All right, so after you've gone through all that, you mentioned, okay, this is a heart attack. It shows up, everything is pointing that direction. You contact the cardiologist. What do they expect from then?
Well, it really depends on several things. What we find in the lab work, one of the tests that we do called a troponin is an enzyme specific to the cells of the heart. If that is increasing significantly, then that may give a higher level of concern to the cardiologist, and they may act upon that by taking you to the cath lab.
Now, you mentioned cath labs. What does that mean for patients? That means dying to the heart?
Sure. I mean, they usually access one of a couple places, either in the groin or in the wrist. And then they do die to take a look at various vessels in the heart and decide, based off their parameters, whether those vessels have acute disease that require acute intervention, such as perhaps a stent placement.
Okay. Now we're going to deviate real quick and real short. Signs of stroke, because that could be another emergency.
Absolutely. Stroke. Baptist Health Lexington is a comprehensive stroke center. We pride ourselves on taking care of stroke. When a person presents to the ER through the lobby, the triage nurse will once again evaluate them. They will either activate what's called a cold stroke immediately, or they will have the physician come evaluate the patient. If it's extremely obvious that it's a stroke, they activate it immediately, and those people proceed directly to the CT suite, at which point they'll have CT imaging to take a look at the head and neck, and that allows us to rule out things like an acute bleed or a mass, and also look more with more detail at all the vessels, and to make sure that there's good blood flow to all areas of the brain.
Well, that's great information. Again, we appreciate all the care that you give the patients, and the emergency room is available to us all, and it's a good thing to have, and we appreciate it.
Thank you, sir. I appreciate it.
We'll be right back.